Good morning. This is a private practice and we do small animal and exotic animal general medicine, surgery, and dentistry here. Today we had a young, healthy male cat come in. His name was Chive. He presented for a dental cleaning and a full oral radiographic exam. We call it CORE for short. Essentially, what we did is a pre-anesthetic workup. So we ran a blood work on him to check his liver and his kidney function, because we require that everyone who's anesthetized here have blood work checked within the last 6 months. So that way we can make sure they're healthy enough to go under anesthesia at all. And this cat actually had a heart murmur. So he also had what's called a pro-BNP test, which is blood work to assess muscle stretch receptors in the heart, because as the heart has more dysfunction over time, the heart will stretch to compensate for that disease process. And when that test becomes abnormal, it makes it more likely for them to have heart-related anesthetic complications or get fluid overloaded or be symptomatic for their underlying heart disease. So we've got an ECG on the cat, which checks like the rate and rhythm of the heart. And then we've got a pulse ox, so it checks oxygenation, saturation, and heart rate. And then we've got blood pressure on it. We've got carbon dioxide output, and we keep them on IV fluids during procedures. And one of the blood pressures read low, and that's not uncommon for cats because they're really, really fluffy. So oftentimes when we are trying to get blood pressures on them, they're not super reliable. So then we checked another one because my rule is, okay, we got one, I want a second one to prove it. And what Casey was asking was if she could feel a femoral pulse. So that's the pulse on the thigh, essentially on the inner thigh. Because if the pulse is palpable, you know immediately that the mean arterial pressure is at least 60, and we don't worry about the blood pressure actually being low unless it's below 60. So we could feel the pulse, which tells me it is above 60, but we got 3 repetitive readings even after I shaved the hair in that area, so that way the blood pressure cuff could access the artery a little bit better. So we went ahead and gave it a fluid bolus, but this cat has a heart murmur, and we ran a test on it this morning. We get worried about anesthetizing animals with heart murmurs because it makes them riskier, but also you can fluid overload them really easily if they're truly clinical for their heart disease. So if their heart isn't able to function normally, and you give them extra fluid, sometimes that fluid can back up into the lungs or into the abdomen. And so we try not to give extra fluids to animals that are already at risk for having an inability to compensate and circulate their blood appropriately. But we went ahead and gave a fluid bolus anyways because the blood pressure was low consistently. And so I just elected to give it a smaller bolus than what I would normally do over a longer stretch of time. Usually 2 people, an assistant and a tech, or a tech and a doctor, will place the IV catheter together and then give the induction medicine. So that's the medicine that makes them fall asleep within a couple of seconds. And then they get intubated, they get hooked up to monitors, they get hooked up to the anesthetic machine, and then the technician starts the cleaning. So it really is the same process that humans have done to them every 6 months when we go to the dental hygienist. I was actually just there yesterday and I was like, oh, I have that dental machine. Oh, I have that scaler. But humans brush their teeth, twice a day, every day, and we still have to go into the dental hygienist and get all that tartar scraped off, whereas animals don't brush their teeth at all. And so when we're going in there with these cleaning tools, we're usually getting a lot of buildup off. Even if you're getting yearly dentals on your animals, there's still a lot that builds up over a year if you're not brushing your teeth at all. Casey or Paige or Ice, which are our technicians here, will scale the teeth, and then they do probing. So we check for pocketing of the gingiva, we check for gingival recession, any oral masses are noted, any abnormal conformation with the mouth, any abnormal conformation with the teeth, missing teeth, obviously loose, mobile, fractured teeth, all of that we jot down in the dental chart. And then they take full mouth x-rays, and then they polish up all the teeth. I always tell owners, everybody gets bubble gum, nobody gets to pick a flavor. I come and I review the x-rays, and essentially the rule of thumb here for tooth extraction is if the tooth is fractured and there is pulp exposure, which is like the nerve or the root of the tooth, then it has to be removed. The jaw bone that the teeth go inside of, the periodontal ligaments of the roots of the teeth are held onto the alveolar bone in the mouth. And when there is greater than 50% bone loss of your jawbone that holds the tooth in the mouth, then that tooth is not a very secure and not a very healthy tooth. And so for that reason, we remove them because they are at risk of pathologically fracturing. We're really big here on dental health and dental prevention. Every year we do Dental Health Month, so the entire month of February, we block off a bunch of additional time and take on extra dental appointments, and we give everybody 10% off. It's truly best to do teeth brushing with pet toothpaste, not a people toothpaste, because humans have fluoride in their toothpaste and that is toxic to animals. We sell things here and you can get things online, and none of them are prescription, but they make like finger toothbrushes and things for animals, or I tell people they can just use like a human soft bristle toothbrush and brush, and that's truly the best thing you can do preventative wise for your pet going forward to help maintain the health of their mouth. And it's something that's really important to get started on at a young age, because if you grab a cat that's 10 years old and stick a toothbrush in their mouth and start scrubbing, they're not going to tolerate that. Same with a dog. It's really hard to, they say, hard to teach an old dog new tricks. So it's important to start when they're young, even with their baby teeth. It's not necessarily that you're wanting to keep the plaque and the bacteria off the baby teeth, but it's about building the habit and getting the animal used to it. I am good. I've got good news for you. So we just finished getting his teeth cleaned up, and I just finished reviewing the dental x-rays. He's got a little bit of bone loss. He diffusely has maybe 10 to 15% loss, and I would say that's pretty normal, but I don't see any teeth that need to be extracted. We did pre-anesthetic blood work on him to check his liver function, kidney function, and the test for the heart muscle enzyme, and all of that was normal.
We want him to be able to cough it back up.
Hello.
Hey there.
Good afternoon.
Hi.
So we just pulled a little bit of blood from Bella and got a temperature on her. Her temperature is normal right now. We saw Bella. Bella was a 10-year-old Yorkie, and she presented for having bloody diarrhea. She is a dog that has had chronic GI symptoms, so inappetence, vomiting, diarrhea. When a small dog like that breaks with bloody diarrhea, you've got to get them checked out right away, because they can get dehydrated so quickly, their blood sugar can drop. So we got her in and we evaluated some blood work on her. But with the stuff we have, I'd like to get a couple of labs on her and check her for pancreatitis today if you're okay with it.
Okay.
You are shaking like a leaf.
She had normal pancreatic values, because one of the first things I thought about was her maybe having pancreatitis and having her pancreas had flared up from her eating something that was too rich for her. And then the rest of her liver values were fine. She had a mildly high kidney value, and that could be from underlying kidney disease, but we can also see that elevate with high protein diets or GI ulcers, sometimes with UTIs. So just because we call it a kidney enzyme doesn't necessarily mean that's the only thing that can cause it to be high. Dehydration can make it high. And then we did a CPL. It's a canine pancreatic lipase test. It's a SNAP ELISA. So that is a qualitative test, not a quantitative test, because it doesn't tell us, how severe the pancreatitis is. It just tells us if it's there or not. And so all of her testing ended up coming back normal. We couldn't get a stool sample on her because she had emptied herself out pretty good. And so we're treating her for gastroenteritis. And essentially it's usually brought on by stress or changes in diet. It's not anything that's usually contagious to anybody, but she did get into a bunch of treats that didn't belong to her. And so having a large meal of something that your body is just not used to, because she's on a prescription food, so she gets the same thing all the time because she has a sensitive stomach. And when she veers from that, this is what happens. So we just treated her with a probiotic kit so we can put all the good bacteria back in her intestinal tract. And the medication has like an antidiarrheal in it, so it'll form it back up. We see exotics here. A lot of places in Michigan primarily focus on cat or dog medicine only. A couple of places you'll find will do like the pocket pets, so like rabbits, guinea pigs, hamsters. But we see pretty much everything that will walk through the door. So I have some patients that are quadrumundis. I see raccoons. I see several primates. We see some aquatic species, lots of reptiles, lots of exotic birds, like backyard flocks, ducks, chickens, that sort of thing, goats, sheep. Literally, if it fits through the door, I've had people bring it here. There's not many places in Michigan, and we may be the only one left, I'm not sure exactly, but that see primates. So we see all of the monkeys as far as I'm aware in Michigan. We have a couple of people that come up from some of the states just south of us as well, and we have certain PPE that's required for those guys specifically. So you have to wear glasses in case of any like splashing of fluids into your eyes. You have to wear gloves. You have to wear long sleeves to protect your arms from getting bitten or scratched. We usually wear, you know, a jacket, glasses, plastic gloves. I'll put my hair back in a ponytail sort of thing. And the staff has to be specially trained. We have certain protocols in place for handling primates. We require that they're sedated. We have bite protocols in case anyone gets injured, you know, what they need to do, because there are some deadly viruses and things that they can pass to us. But aside from the monkeys, the remainder of the exotic species that we see, we don't have so much of a worry as far as protecting ourselves from their illness. But there are some dangerous ones. We've done bobcats, lynxes, foxes, that sort of thing. And again, albeit these animals are considered someone's pets, they still have teeth. And oftentimes these animals haven't ever been in the car before, haven't ever been to a veterinarian before, and they're not used to the sounds and the smells and strangers touching them in weird places. And so we have to be careful, but it's fun. We get a lot of cute pictures and cute videos, and we get to share that with our family and share it on our Facebook so like our clients and things can see it. Good afternoon. I have the girls bringing your adjustable chair and your arm towel. And Piper is a little dachshund. She's 13 now, and I've been seeing her for years for acupuncture. She has a chronic history of herniated discs in her back, like many dachshunds do. Because of their long back, they're more at risk for having ruptured or herniated discs along it. And those can lead to pain and incoordination or paralysis. And so she's been coming to me once a month for years now, just to kind of keep those symptoms at bay.
But she's been, I guess, looking into door corners and...
Because we weren't really sure before, and I was like, well, it seems like that's likely, so I don't know if there's anything else we could do for that, if that's specifically what's going on.
The only things we can do for dementia dogs, which is called canine cognitive dysfunction, is essentially like supplemental things. So Denamarin, the liver supplement, is really good for the brain. Essential fatty acids, which are like omega-3s, 6s, that sort of thing, are really good. And since she has had like flare-ups with pancreatitis in the past, we wouldn't want to give those orally. because they can cause a pancreatitis flare because they're an oil-based product, but
Okay.
they make a topical that will absorb through their skin.
Okay.
It's almost like applying like one of those topical flea preventions.
Okay.
Recently, the owners have been sharing with me that she's been developing some signs of dementia. She'll stare into corners or seem confused or dazed and not seem to recognize her owners sometimes. And I think that's one of the saddest things that can happen to a human or to animals, to have your loved one not recognize you or know where they are and not be able to help or explain what's going on. And so for her, what I had recommended is there are some supplemental treatments and some medications in addition to the acupuncture and the laser therapy that she gets that we could add on that might slow down that progression, but there's nothing we can do, unfortunately, to take it away. Piper, do anything fun recently?
And the last fun thing was going to Canada. She's been chasing the squirrels in the backyard. That's been fun for her. We had to, because we got like a walnut tree in the backyard, so we had it like, for like the 2 weeks they were all dropping, we had to like fence it off, so she was restricted to like half of her yard, and she wasn't happy about it. And then everything's gone now, so we took the fence away, and the squirrels have been coming out to play, so she's just been having extra fun spending time in her backyard lately.
But as she's gotten older, she's developed a few more problems. She's got stones in her gallbladder now, and she has pancreatic issues, and she's had liver issues in the past, so I'm kind of using the acupuncture to treat a couple of locations for all of that stuff.
She's also been enjoying the colder weather too, because I mean she gets to.
Does she like it?
Well, she gets to snuggle more under like blankets and stay warm. I think she looks comfier when it's colder out because she gets all these blankies and just always looks super comfy, just like snuggled underneath them or something. But also with these last couple of nice days we've been having, she said, no, we're gonna spend more time outside too, so.
The reason why I'm in primary care and the reason that I love primary care so much is truly the relationships that you build, not only with the animal, but with the owner and with the family too. A lot of who I refer to as the adrenaline junkies, so the people who are ER and love the action and love the trauma and the drama, they don't like primary care because they think it's too repetitive, it's too boring, it's too monotonous. But we try to keep it interesting here because we do a lot of non-routine things, but I love developing relationships with people. I love seeing, somebody bring in their dog, and then the next year they're with their fiance, and then the next year they're with their husband, and then the next year they bring in a baby, and then the year after that they bring in another baby, and then 4 years down the road they've got 2 little kids running around and they're on their second dog. And I love growing with them and knowing about their life and being a part of the animal's life from birth until death. And so doing sympathy cards, I think, is important because they're these people that we see and whose pets we treat. They're part of our family here. And if, your friend or somebody lost someone close to them, because people's pets these days are not just animals, they're truly part of their family. It's their kid, it's their brother, their sister, that sort of thing. And so I think giving them cards and letting them know we're thinking about them is really, really important. And oftentimes it's not an easy decision for these people to make. So I'll, write something in there like, I support your decision. I know that was really hard. I think you did everything you can do. And frequently I'll have people come back to me with commentary and they're like, I really, really appreciate what you said. Thank you so much, because that allowed me to receive the closure that I needed to get past this. Rollo was presenting to me for a recheck of his incision. Actually removed a sarcoma off of Rollo, which is a type of cancerous tumor. And after we sent out his mass, we found out what it was, and that the margins were narrow, meaning we did get all of the cancer, but we cut it close. So the owners have been doing a really good job kind of keeping an eye out on that incision. I know. You're asking so politely me to stop pinching your skin. I'm sorry. I know. I love you. You're very sweet. You are. You're a very good boy. I know. You're welcome. And what they noticed was that it started to have some pustules, which are almost like little zits or pimples. And so when he came in and I evaluated those, we kind of popped the pimples and put him on a slide and looked at him under the microscope, and he did have a bacterial infection there. So we treated him with a couple-week course of antibiotics, and today we were seeing him back, and his incision in his skin looks great. But I told the owners keep a really close eye out for further bumps and keep an eye on him because he's also got underlying kidney disease, and so that's something that they and myself have been working together to manage long-term on him, but he's been doing great, and I hope he keeps doing great.